Hello ACPS family and ACPS families. This is Dr. Hutchings and I'm here joined with Dr. Herring, our director of the Alexandria Health Department. Today we have three things we want to discuss with you. One is spring break, two is our 3 feet versus 6 feet social distancing, and three is our new variants. And as you all know, spring break is coming and ACPS is strongly discouraging non-essential travel during this spring break season. Successful reopening of our schools, it really is going to depend on you as our staff as well as our families. If you have to participate in essential travel, please participate in low-risk activities. For example, instead of flying to your destination, drive to your destination. Participate in outdoor activities instead of having indoor activities, especially with household members outside or people outside of your household. You want to limit your contact to one household if you are visiting others outside of your household. And you also want to go to places where you can maintain social distancing. The Virginia Department of Health, they provided guidance on travel, and specifically, they're encouraging all individuals who are having any type of essential travel to get tested 1 to 3 days before travel and 3 to 5 days after travel. Also consider staying home and self-quarantine for 7 days after essential travel. And that's if you test negative on day 3, 4, or 5. You should self-quarantine for 10 days if you do not get tested. And I want to remind you that free testing is available 7 days a week at several locations throughout the city of Alexandria. I want to reiterate, we have to wear our mask, we have to maintain 6 feet social distancing, we have to make sure that when we are entering our school buildings that we're completing our daily symptoms checklist, and we're also doing our temperature screenings throughout our school division. I want to turn things over to Dr. Herring to talk about some other aspects in regards to our 3 foot versus 6 feet, as well as our new variants.
Thank you, Dr. Hutchings. So I will talk about the 6 versus 3 foot distance that are recommended and the variants as well. So there's a lot of information out there about, is 3 foot good enough or is it 6 foot? Most of the data is showing that 6 feet of distance is the safest. And that's what we're recommending as the Alexandria Health Department, because that's the gold standard. There's also a lot of information out about variants. A variant is like a new form of the virus, and there's a lot of information that we still don't know about the variants. We don't know how much more severe it is. But one of the things that we do know about the variants is that the 6 foot of distance and the masking helps to reduce the transmission. Dr. Hutchings just talked about travel and about the importance of getting tested. I want to reiterate, don't travel unless you must travel. And if you do, reduce the risk of transmission by wearing your mask, maintaining a distance. And the other thing is, if you're eligible to be vaccinated, get vaccinated before you travel. That will help to reduce your risk of needing a hospital and reduce your risk of getting really profoundly sick and reduce the risk of actually dying. What we don't know about the vaccine is, does it reduce the risk of transmission? And that's why we at the Alexandria Health Department are still recommending masking and 6 foot of distance. So thank you very much for keeping everybody in our community safe.
And finally, we want to thank all of our families for everything that you all are doing to help us make sure that we can keep our buildings open. This does require an all hands on deck approach, and we need you to continue to do your part. Enjoy your spring break.